It's almost a running joke in healthcare, isn't it? The sheer volume of regulations, it feels like you need, I don't know, a special decoder ring just to figure out the basics
Oh, absolutely.
in staying compliant. That's a whole other challenge.
It really is. And, in a field where precision and trust are just so critical, that complexity kind of highlights why healthcare policy audits and compliance are so vital. It's not just checking boxes. It's about building a safer system for everyone.
Exactly.
Yeah.
And that's what we want to tackle today. To help navigate this pretty intricate landscape, we've pulled together insights from quite a few sources.
Okay.
We've got info from Joint Commission International, a look at the ITech Act from Kiteworks.
Yeah.
Stat Pearls gave us a deep dive into IPOA perspectives from NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers in India, and also the global view from ISQA, the International Society for Quality in Healthcare.
Right. A good mix.
Yeah, and some practical stuff, too, from the QI playbook and doctor's management. Plus, we'll get into some real-world HIPAA screw-ups, examples from Strong BM, and those 7 key compliance components from MedTrainer.
So our goal today really is to sort of pull all this information together. We want to boil it down to the essentials of policy audits and compliance for you.
Right.
Let's move beyond just like definitions. Why does this stuff matter so much? What are the key pieces? Hopefully give you some clarity, maybe a few aha moments without it feeling like you're drowning in jargon.
Okay. Sounds like a plan. So let's start right at the beginning. When we talk about healthcare policy audits and compliance,
Sure.
what are we actually fundamentally talking about?
Okay, good question. So at its core, a policy audit is really a systematic look at a healthcare organization's own rules, their policies and procedures. The aim is kind of twofold. First, are people actually doing what the policies say? Are they following them? And second, are the policies themselves still any good? Are they relevant, effective? Do they line up with the organization's goals and, crucially, all the regulations out there?
So it's not just having rules written down somewhere. It's checking if they're actually being used and if they even make sense anymore.
Exactly. And compliance, well, that's the start of actually following those internal policies, plus all the external laws, rules, regulations that healthcare has to deal with. Local, national, sometimes even international stuff.
Okay. Now, why is this level of, scrutiny so vital in healthcare? Sometimes it feels like just endless paperwork and checks.
Yeah, I can feel that way. But the importance really comes down to a few deeply connected things. Patient safety is number one.
Obviously.
Compliance frameworks make sure that best practices, evidence-based stuff are actually in place and followed consistently. That directly reduces the risk of patients getting hurt.
Makes sense.
Then there's data privacy, huge deal. We're handling super sensitive personal health information.
Yeah.
And finally, healthcare is just tangled up in this incredibly complex web of regulations from all sorts of governing bodies. You just have to adhere to them. It's non-negotiable.
We're talking about bodies like the Joint Commission, CMS Centers for Medicare and Medicaid Services, those kinds of groups.
Exactly those. The Joint Commission International, for instance, their big vision is basically zero patient harm and super reliable care. They work with hospitals and clinics worldwide, guiding them on continuous improvement, getting those best practices adopted.
Okay.
And like you mentioned, NABH in India does something similar, setting up accreditation programs, specific benchmarks for their healthcare system, really pushing for better quality there.
Right.
And ISQA, that's the global one, pushing for quality and safety improvements everywhere.
Okay, so it's definitely more than just avoiding fines. It's really a basic commitment to patient well-being and keeping the whole system trustworthy.
Absolutely.
So that brings us to, why should organizations proactively do these audits? What's the drive beyond just, not getting into trouble?
Well, yeah, staying on the right side of the law is a big motivator, obviously, but proactive audits give you real strategic advantages.
How so?
They give organizations a structured way to stay ahead,
Yeah.
making sure they meet today's standards, but also getting ready for whatever changes are coming down the pike regulation-wise. Think about HIPAA. Auditing your patient data privacy policies regularly isn't just ticking a box. It's about building a culture where privacy matters, preventing those, frankly, devastating data breaches.
So it's kind of future-proofing the organization as much as checking current compliance. What else do audits help with?
Oh, they're fantastic for finding hidden problems, gaps, weaknesses in your existing policies.
Like what?
Well, over time, policies, even good ones, can get outdated, right? or they just don't work well anymore. Maybe they even cause new problems.
Yeah, I could see that.
Audits shine a light on that stuff. They let you see the inconsistencies, refine procedures based on new evidence, adapt to new laws, or even just make your own operations run smoother. A classic example is infection control. Those policies need constant updates for new bugs or new guidelines from the WHO or CDC, right?
Right. Things are always changing. So it keeps the organization nimble, not stuck in the past.
Yeah.
And I assume there's a direct link to patient safety, too.
Huge impact. By really digging into how well safety policies are working, audits directly make the care environment safer.
Okay.
They can spot risks that maybe nobody noticed, pinpoint areas where safety rules need strengthening. Think about surgical safety checklists, auditing to make sure they're used properly every single time. That can literally prevent errors during surgery.
Wow, yeah. That definitely highlights the practical, potentially life-saving side of it.
Yeah.
And what about the money and legal side, the risk?
Proactive audits are a key risk management tool. Being non-compliant, that can mean huge fines, expensive lawsuits, even losing your accreditation.
Right, the stakes are high.
So by finding and fixing potential compliance issues early through regular audits, you seriously reduce your exposure to all that. Making sure your workplace safety follows OSHA rules, for instance, that directly avoids those hefty fines.
Okay, the benefits are definitely clear. Let's dive into some of the big regulations that specifically HIPAA and the HATEC Act. What are the absolute key things we need to grasp about these two?
Okay, so IPEA, Health Insurance Portability and Accountability Act. Back in 1996, it set the stage, laid down the basic rules for protecting patient privacy and keeping health information secure. It defined who had responsibilities, providers, insurers, billing companies, EHR vendors, basically anyone handling health info. They call them covered entities.
And it has those different sections or titles.
Yes, 5 titles. But for today, Title II is really the one to focus on. It deals with fraud and abuse, administrative simplification like standardizing electronic transactions, and most importantly for us, the privacy and security rules. These govern what we call protected health information, or PHI.
PHI. We hear that acronym all the time. What exactly is PHI?
Okay, so PHI is basically any information that can identify a specific person and relates to their health, past, present, or future health status, the care they get, or how they pay for it.
So not just the diagnosis.
Oh, no, it's broad. Obvious stuff like name, social security number, medical record number, but also less obvious things, address, email, phone number, even photos or fingerprints if they're linked to health info.
Wow.
And it doesn't matter if it's written down, electronic, or just spoken aloud. If it identifies someone and relates to health, it's likely PHI.
So pretty much anything connecting health data to a specific individual.
Yeah.
And there are different rules for how you handle it, depending on the situation.
Exactly. The HIPAA privacy rule controls when and how these covered entities can use and disclose PHI. Now, use means handling PHI inside the organization like a doctor looking at a chart for treatment.
Yeah.
Disclosure means sharing it outside the organization, sending records to another doctor for a referral, for example. Generally, patients have to give permission, authorize, for their PHI to be used or disclosed for anything beyond treatment, payment, or standard healthcare operations.
But there must be exceptions, right?
Yeah.
Situations where you don't need specific patient permission.
Yes, absolutely. There are specific legal exceptions. Usually these involve a strong public interest. Things like reporting suspected child abuse or notifying public health agencies about certain infectious diseases or responding to a court order.
Okay, that makes sense for public safety and legal reasons.
Yeah.
Now, how is the HIPAA security rule different from the privacy rule?
Good distinction. While the privacy rule covers all PHI, regardless of format, the security rule focuses specifically on electronic protected health information, ePHI.
The digital stuff.
Exactly. It requires covered entities to put in place a whole set of safeguards, administrative, physical, and technical, to make sure that electronic data stays confidential, maintains its integrity, and is available when needed.
Can you give us an example of each type of safeguard, like administrative, physical, technical?
Sure. Administrative safeguards are basically the policies and procedures. Things like conducting regular risk assessments to find vulnerabilities, training staff on security practices, having a designated IPS security officer.
Okay.
Physical safeguards are about protecting the actual physical locations and equipment. So locked server rooms, rules about using workstations securely, how you handle laptops or drives.
Right. Locks and procedures.
And technical safeguards use technology itself. Things like encryption, so data can't be read if intercepted, strong passwords or multi-factor authentication to control access, and audit logs that track who accessed what data and when.
Okay, so IPA set that foundation. Then ATEC came along in 2009. What was the deal with HITECH? What did it change or add?
Right, the HITECH Act, Health Information Technology for Economic and Clinical Health Act, it really built on IPA. Its main goals were to push the adoption and, importantly, the meaningful use of electronic health records, EHR.
Ah, yes, meaningful use. That was a huge buzzword.
It was. HITECH also aimed to seriously strengthen the privacy and security rules, especially for electronic information, and beef up the enforcement side of things.
So what did meaningful use actually involve, beyond just using an EHR?
It was essentially a government incentive program. Doctors and hospitals got money if they could prove they were using certified EHR technology in specific ways that improved care quality, safety, or efficiency.
Like using e-prescribing or tracking clinical quality measures.
Exactly. There were different stages, requirements got tougher over time, and if you didn't meet the criteria, you faced penalties, lower Medicare payments. It was a big push to digitize records and use the data better.
A carrot and stick approach.
Pretty much. But HITECH didn't just focus on adoption, it also significantly ramped up the privacy and security requirements from HEPR, especially for EPHI.
How so?
A really key addition was the breach notification rule. Before HITECH, the rules for telling people about data breaches were, well, fuzzier.
And to firm that up, what does the rule say?
Yes, it made it mandatory. Covered entities must notify affected individuals, the Department of Health and Human Services, HHS, and sometimes even the media if there's been a breach of unsecured PHI.
Unsecured, meaning like unencrypted.
Generally, yes. Information that wasn't properly protected. And the notification has to be quick without unreasonable delay, and definitely no later than 60 days after discovering the breach.
60 days. That sounds tight, especially for big breaches.
It is, and for really big breaches affecting over 500 people in one area, they usually have to notify HHS and the media almost immediately. It's about transparency and letting people protect themselves if their data is exposed.
Okay. And HITECH also affected penalties.
Big time. It significantly increased the potential fines for HIPAA violations. Civil penalties could go up to $50,000 per violation, with big annual caps. Plus, it introduced clearer paths for criminal penalties for really serious or knowing violations. HITECH definitely added teeth to HIPAA enforcement.
Wow, okay, so it really raised the stakes. Any other major impacts from HITECH?
Yes, a couple more key things. It actively promoted health information exchanges, or HIEs. These are networks designed to let different doctors and hospitals securely share patient information electronically. The idea was better care coordination, fewer errors.
Makes sense.
And finally, a really important point. HITECH extended direct liability for certain HIPAA rules to business associates.
Those are the third-party vendors, right? Like a billing company or a cloud storage provider.
Exactly. Before HITECH, the covered entity was primarily responsible. HITECH said, no, these business associates who handle PHI are also directly on the hook for complying with parts of APA, especially the security rule and breach notification.
Okay, that's a big shift, holding vendors directly accountable. So if we boil down the differences, HITECH set the original privacy security rules for all PHI. HITECH focused heavily on electronic records, pushed their adoption with incentives penalties, toughened enforcement with bigger fines and mandatory breach notices, and made business associates directly liable.
That's a great summary. HITECH really modernized and strengthened HIPAA for the digital age of healthcare.
Got it. Okay, so we understand the what and the why of audits and compliance and the landscape set by HIPAA and HITECH. Now, let's get practical. How does a hospital or clinic actually do a policy audit? What's the process look like?
Right. Well, drawing from sources like the QI playbook, the very first step, and it's crucial, is just gathering everything up. You need a complete inventory, review all your existing policies.
All of them. Clinical operation.
And everything. Clinical protocols, how operations run, financial rules, administrative procedures, from how you admit a patient to how you dispose of old records. Get it all together.
Okay, step one, collect all the rule books. Then what?
Then comes assessment. You have to figure out if people are actually following these policies consistently in their daily work.
How do you do that? Just watch people.
It's a mix. You review documentation, patient charts, logs, things like that. You conduct interviews with staff, confidentially, of course. You might even use surveys to see how well policies are understood and followed.
So, multiple angles to see if the rules are actually reality.
Exactly. And while you're doing that, you also need to check if your internal policies line up with the external rules. Are they meeting the latest standards from the Joint Commission, CMS, state laws, whatever applies?
Ah, okay. So comparing your rules to the regulator's rules.
Precisely. If there's a mismatch, your policy needs updating. Stat.
And I bet talking to the staff, the people actually doing the work, is pretty important here.
Absolutely vital. You need to gather data and feedback directly from employees. The nurses, the doctors, the admin staff, they know what works and what doesn't in practice.
Right.
They can tell you if a policy is confusing, hard to follow, maybe causes unintended problems, or just isn't achieving its goal. Their input is gold.
So it's like a 360-degree view. The documents, the practice, the external standards, and the employee experience. Once you have all that info, what's next?
Analysis. You sift through everything you found and pinpoint the problem areas. Where do policies need changing? Where does staff need more training? Do you need different resources to make compliance easier?
Okay, identify the gaps.
Then you build an action plan, a clear, concrete plan. What specific steps will fix the problems? Who is responsible for each step? What are the deadlines? And how will you follow up to make sure the changes actually stick?
It sounds like a cycle, really. Assess, analyze, act, then probably assess again later. And that brings up ongoing compliance. It's not a one-and-done thing, is it?
Definitely not. Compliance is a marathon, not a sprint. It needs constant attention.
So how do organizations keep that momentum going, keep compliance front and center?
Well, first, make audits regular. Like the QI playbook stressed, don't just do them when you have to. Schedule them. Annually is common, maybe even quarterly for really high-risk areas like, say, pharmacy operations or data security.
Okay, keep checking.
Second, keep staff involved. Seriously value their input. They're often the first ones to spot potential issues or have ideas for making things better and safer.
Makes sense. They're on the front lines.
And third, continuous education. Training isn't just for new hires. After an audit finds something or when a policy changes, you need targeted training so everyone understands the update and what they need to do differently.
That makes total sense. Okay, we've talked rules, process.
Yeah.
But what does it look like when things go wrong? What are some typical HIPAA violations we actually see happening?
Yeah, sources like StrongDM and StatPearls give us some unfortunately common examples. A big one, surprisingly basic, is just not having good enough HIPAA training for everyone. Another one is failing to do that comprehensive organization-wide risk analysis we talked about. You have to know where your vulnerabilities are.
Right.
Then there's just sort of careless handling of medical records, leaving screens unlocked with patient info visible, paper charts lying around in public view.
Things that seem small but can have big consequences.
Huge consequences. Other common ones. Using unencrypted email or texts to send PHI. Not having strong enough defenses against cyber attacks, that's a big one now.
I bet.
Sharing patient info without the right authorization, even with family sometimes, if it's not directly related to care or payment. Losing track of laptops or USB drives with PHI on them. StatPearls mention a practice getting hit hard after losing an unencrypted flash drive. Ouch.
Yeah, that sounds bad. Seems like a lot of these come down to human error or just not thinking.
A lot do. Talking about patients in hallways or elevators, even casual chat can be a violation. Making mistakes and disclosing the wrong patient's info. Not shredding paper records properly or wiping hard drives before disposal.
Oh, wow.
Social media is another danger zone. Staff posting anything about patients online, even vaguely. Huge no-no. StatPearls had an example of someone posting about a patient's death.
Oh my gosh.
And a really common technical one, forgetting to have those business associate agreements in place with vendors who handle your PHI. Both HI Tech and StrongDM flagged that.
That's quite a list of potential pitfalls. And StatPearls had some pretty stark, real-life examples of violations and what happened, didn't they?
They did. Really sobering stuff. Staff yelling out someone's HIV status in a waiting room. An office manager accidentally faxing records to the patient's employer instead of their new doctor.
Oh, wow.
A surgeon snooping in a celebrity's EHR. A pharmacist sharing prescription details inappropriately. University staff looking at records they had no reason to access. A vendor losing a laptop with unencrypted patient data from cardiac monitors.
And what were the consequences? Fines. People getting fired.
All of the above. Significant fines for the organizations, people losing their jobs, sometimes even criminal charges depending on how bad it was. It really shows this isn't just theoretical risk.
Definitely underscores the need for a solid compliance program. Which brings us to, how do you build one? What makes a compliance program effective?
MedTrainer laid out 7 key components based on guidance from the Office of Inspector General. Number 1, have written policies and procedures. Clear rules, including a code of conduct setting the ethical tone.
Okay, written rules first.
Second, Compliance leadership and oversight. You need someone in charge, a designated compliance officer, and you need buy-in and visibility from the very top leadership.
Got it. Tone from the top.
Third, training and education, not just once, but ongoing tailored programs for different roles. Fourth, effective communication lines. People need a safe way to report concerns to the compliance officer without fear. Anonymous hotlines, open door policies.
Right, make it safe to speak up.
Fifth, enforce your standards. There have to be consequences for not complying, and maybe even incentives for doing things right. Consistency is key.
Fair enough.
Sixth, risk assessment, auditing, and monitoring. You need a formal process to regularly look for risks, check compliance, and monitor activities. Be proactive.
Like we discussed with audits.
Exactly. And seventh, respond properly when you do find a problem. Investigate detected offenses, figure out why they happened, and develop corrective action plans to make sure they don't happen again.
Okay, those 7 components seem like a really solid framework. Now, how does accreditation fit into this picture? Organizations like the Joint Commission, NABH.
Accreditation is like an external stamp of approval. Bodies like the Joint Commission set high standards for quality and safety, covering pretty much everything a hospital does. Then they come in and do these intensive surveys to see if the organization is actually meeting those standards.
And those surveys can be unannounced, right?
Often are, yes. They happen every 18 to 36 months usually. The goal is to assess compliance and drive continuous improvement. It's not just a snapshot.
And they use that tracer methodology you mentioned earlier.
Yep.
Following a patient's journey.
Yes, that's a key part. They trace a patient's experience through the system from admission to discharge, looking at care processes, communication, medication safety, everything. It helps them see how policies actually play out in real patient care.
Okay.
They also do system tracers, looking at big processes like infection control across the whole hospital, and program-specific tracers for areas like stroke or cardiac care.
And getting accredited is pretty important, I assume.
Oh, hugely. Often you need Joint Commission accreditation to get liability insurance or to get paid by Medicare and Medicaid. It's a major validation. And NABH, as we said, provides a similar vital accreditation role specifically within India's healthcare system.
So accreditation acts as both a quality benchmark and a strong motivator for maintaining compliance. We also heard about different types of audits. Can you quickly run through those?
Sure. Doctors Management broke them down nicely. You've got internal audits done by people inside the organization. These might focus on overall compliance or maybe specifically on coding and billing accuracy or privacy and security practices.
Okay, checking yourself.
Then external audits. These are done by outside groups, could be insurance companies checking claims, CMS looking for fraud or abuse, or independent third-party auditors.
Right, someone from the outside looking in.
Then random audits. These are usually unscheduled checks of a sample of records, just to get a general feel for compliance levels and potential risks.
Kind of like a spot check.
Exactly. And finally, the distinction between proactive and reactive audits. Proactive is when you decide to audit to find potential problems early, collaboratively. Reactive is when you audit because something already went wrong, an error happened, you got a complaint, etc.
Proactive definitely sounds like the smarter way to operate. Less stressful, too, probably.
Absolutely. It's about finding and fixing things before they become big problems, which ties into the whole idea of continuous monitoring and improvement.
Right. That seemed to be a common thread.
Yes, both Doctors Management and MedTrainer really hammered this home. Ongoing, proactive monitoring is key. It helps ensure compliance stays strong over time, but it also leads to better patient outcomes, smoother processes, earlier risk spotting, and more accurate documentation.
And technology can help with this.
For sure. Platforms like Kiteworks, which focuses on secure data handling, or MedTrainer, which helps manage policies and training, they offer tools that make continuous monitoring easier. Things like strong encryption, controlling who accesses data, keeping audit trails, automating policy updates, delivering online training, streamlining how you report incidents. Technology can be a huge enabler here.
Okay, so wrapping it all together, it's about knowing the rules like HIPAA and HITECH, having clear internal policies, constantly checking if they're being followed through regular audits, being proactive, using staff feedback, providing ongoing training, and leveraging technology to help manage it all.
That's a really good synthesis, yeah. Healthcare policy audits and compliance, they aren't just bureaucratic hoops to jump through. They are absolutely fundamental. They underpin safe, ethical, high-quality care. It takes ongoing vigilance, understanding the regs, having strong programs, using tech smartly. It's a continuous commitment.
Definitely. And as we wrap up this deep dive, maybe something for you, the listener, to think about. How do healthcare organizations strike that balance? The balance between meeting these really rigorous compliance demands and just the day-to-day reality of delivering compassionate, effective care. How can they build a culture where compliance isn't seen as this separate, burdensome thing, but actually as part of the core mission integral to providing the best possible care?
That's the key question, isn't it?
It is, and we really encourage you to keep exploring. Check out resources from the Joint Commission, from HHS, NABH if you're in India, ASQA, for that global perspective. There's a lot more depth to uncover.